I'm a team leader working with community healthcare workers who are working with TB patients. As I was working with the community, I fell in love with working with patients with TB.
Me wanting to be a community health worker, it's because that I wanted to make difference in our community.
They're starting to understand why are we there and why are we visiting them regularly in their homes. So they appreciate it, and that makes me feel good that I'm actually helping someone getting healthy and living a healthy lifestyle.
We are an NGO, a TB advocacy organisation, funded by the Bill and Melinda Gates Foundation for our project, Community Health Worker TB Champions. The healthcare workers were personally affected by TB, and they started the NGO to create awareness about TB and decrease stigma. So we use personal storytelling and we combine it with scientific evidence to advocate for high quality TB care in South Africa and across the world.
This TB story, I started to feel, I was sweating sometimes and I was getting tired. So I started to realize that something's wrong about me. So at last I did go by myself. I was having a TB by the time.
We worked with 15 community health workers, and they are managed by an outreach team leader who is an excellent local leader from the community as well, passionate about ending TB.
From the start, I wanted to become a health worker. I followed a career in nursing. And as I was working at the clinic, I saw that there was a problem with TB patients. And today, I'm a team leader working with community healthcare workers, and currently we are advocating for patients on a daily basis.
Their team is also linked to the nursing staff at Kekana Stad Clinic, and they have a good relationship because the nurses give in-service training to community health workers.
I come in to ensure that these patients are linked to the clinics, and once they are on treatment, these patients can get proper support.
Oh, the skills from the community workers, they've got all the leadership skills because they can come with the patient to the clinic, and they have also good communication skills because they were able to convince the patient from the community to come to the clinic when they are sick to request help and for medication.
So community health workers' roles are visiting households, building relationships with patients and establishing trust to educate patients, and then link patients with TB symptoms such as coughing or fever to a health facility. So without them, many patients would be missed and not linked to any health care.
I've seen that our community actually needs our help, especially giving service in their houses, because some they couldn't come to the clinic, especially old people, people with TB and all those things. So I decided, maybe if you can join these people and work with the community, it's going to be fine.
I went to the clinic. I met one of the community health workers. So they were asking us the questions. How can they help us? So encouraging us also not to give up and like this. They used to come to us and check, am I drinking this medication in the right manner or what? So, but I was so happy. I'm happy with the community health workers because they help us. They help me too much. It's not me only, but most of the people here, I'm encouraging them to go to them and seek for help.
Our strategy was to work at local and at national level. So at local level, we engage with these community health workers who are known and trusted and loved by their communities. And we were able to find out what are the barriers to accessing care in Hammanskraal, what could be done so that people can be linked to TB care. And that is where we could learn from them that TB stigma was a main barrier to accessing care.
Go tshwana la re tlile tleliniking a ba o fa dipilisi ba tsamaya ba bolela ba tshabisa ke ntho o bone ba change ditleliniki.
Part of our strategy was for them to come up with solutions, and it was just fantastic to see their innovation because they came up with a theatre play directed by a local television star.
And people were like, wow, really, celebrity in Kikanasta Clinic. That's when they had this attention towards, and they took us seriously. That this community healthcare workers, it's working.
Sometimes you get somebody who's sick, and he or she is afraid to talk to people because he or she thinks she'll be labeled by the sickness. So it actually helped us break that stigmatization barrier.
Afterwards, when we did surveys, it showed that stigma was reduced and people felt empathy for their fellow TB patients in the community.
And I enjoyed playing the main role in the play.
TB Proof employed a community health worker, Portia Muedi, and she was key to establish relationships here in Hammanskraal with the 15 community health workers from the Gauteng Department of Health.
My role was to be a link between TB Proof and the CHWs in Hammanskraal. We go to households together with the community health care workers so that I can get to know them. We also made the advocacy letter together so that we can know their priorities, and I handed in the advocacy letter in person to the Minister of Health.
It was encouraging for us to see that after the TB advocacy workshops, community health workers engaged directly with National Department of Health policymakers, and they asked for high quality standardized training, adequate infection prevention control equipment, and adequate remuneration.
People now see me as somebody who comes with a big impact into their lives, giving health education, referring them to the clinic whenever they have problems.
If they were not there, I don't think I was supposed to go there. They are my sisters. Even my kids, they know them very well. Healthcare workers are here to help us.
From understanding these patients, the process that they go through, from identifying their symptoms to being on treatment, that really touched me. So to date, they are close to my heart.
It brings peace in your life when you know that you wanted to help people and then now I'm actually doing it.
I'm strong now.
After I had TB, it really changed me to my core. It felt like I was stripped away of everything. And after such an experience, I just became aware that and passionate about helping others and the need to increase quality care. And that is why I felt it's so important to get involved as a TB activist, because we need better quality care for everyone, because health is a human right for all.
I'm one of the survivors. I'm healthy now, I'm normal.
And you are a TB champion now.
I'm a champion.